Welcome back to Great Day Live. Thanks so much for sticking around with us.
And today we're celebrating National Senior Citizens Day, recognized every year since August 21st, since the 1980s. And right now we are turning our attention to an innovative organization that's based right here in Louisville, helping CEOs across companies that are based here in Louisville elevate not only the companies they work for, but those who work for them. They're utilizing and leveraging their support and services. It's called the Louisville Healthcare CEO Council.
Tammy York Day is the head of LHCC and joins us live this morning. Tammy, good morning. Good to see you.
Good morning. Thanks for having me.
Oh, of course. Happy to have you on today. Let's start here. For those who might not be familiar with what LHCC is, can you talk us through what it actually is?
Absolutely. You know, the Louisville Healthcare CEO Council really was formed through David Jones Sr. and what he saw as a need to bring together the CEOs of these large corporations that we have sited here in Louisville, Kentucky, that really focus on healthcare and aging innovation. We're in a world that 1 in 5 people are going to be over the age of 65 in 7 years. When you really look at where we are on the bell curve with an aging nation, there's such a need to leverage a cluster. So we focus on aging innovation in healthcare and to provide national solutions to the challenges we're facing, and also to rally around and grow our healthcare ecosystem here for economic vibrancy.
And Tammy, why is aging innovation so important, and why do you say that Louisville is so uniquely positioned to kind of be the leader in this space?
It really, when you look at the companies that are based here, just by this natural evolution of our history of healthcare from this city, people don't realize that we have the strength of cluster that we do here. The council, with our 13 member companies, represent everything from when you enter, the system in the hospital through end of life. We have payers, providers, the long-term care, assisted living, acute care, and this whole continuum and this line of sight that we have here represented in Louisville. The council represents $120 billion with these member companies in revenue, 475,000 employees nationally. So we're uniquely positioned to be able to provide those solutions nationally and really rally around this. And it's very important for Louisville.
Tammy, I'm going to ask you a question out of genuine curiosity here. Why Kentuckiana? When you talk about the strength of cluster, I think, as you put it, that we have here in this sphere, I don't know if my question is how did that happen or why did that happen specifically here?
It's very interesting. There's a whole history. Some of our ecosystem partners like Health Enterprise Network and others have mapped our history of healthcare, dating back to, where we are positioned in the central kind of location for the nation. And it's a fascinating evolution. I would welcome everybody to go look at that because they really mapped that history. But it was an organic evolution of the companies that are sited here. And a lot of our work centers around really having this not be a secret. When we have this density of cluster, that organically sprang up. And when we look at our aging, population in the U.S. and the need for a really outcomes-based healthcare system that supports it, we're very organically, uniquely positioned. What the council did and the vision with this, with the CEOs that make up our board of directors, they came together and said, let's really take this in a really very strategic way to move the needle forward for the aging innovation with the perspectives that are different from each of our individual ones. So we center around innovation there, and it's very organic from the roots.
Wow.
And Tammy, you guys are always kind of setting the bar higher when it comes to your partnerships and your events and your ways to get leading innovators to the table to present their ideas. What is coming up next for you all?
We have on September 28th, and it's posted on our website, our Bridging the Gap, which is our CareTech competition. We do discovery in our council companies to say, what are the challenges? When we look at the buzzwords and, interoperability and the real challenges with social determinants of health, what does that mean to each individual company? What innovation is being done and where are their gaps? And how can we look at a new future of healthcare by leveraging innovation, technology to answer and fill those gaps and challenges and realign a system? And so we have our CareTech pitch from our Global Innovation Search coming up September 28th. It'll be virtual because we are in a pandemic with a variant that we're trying to move past. But we're very excited about it. We've launched our first pilots and lots more to come for this community. And I think it's something that in a sometimes grim world that everybody can be excited about.
Thank you so much for sharing all the positive news, and keep up the great work, Tammy.
Thank you so much.
To learn more about the Louisville Healthcare CEO Council, visit lhccinc.com.